So testing the radial pulse. Now, the radial pulse is probably one of the most easily palpated pulses in the body. To find the radial pulse, we just follow the thumb all the way down on that outside portion, just past where the tendons sit, and we should be able to quite easily feel where that radial pulse is. And we're feeling for this boom, boom, rate and rhythm. Now, palpating the radial pulse can be quite a nice thing to add into your cardiovascular screen. We're looking for around 60 to 100 beats per minute. Now, as you can see, there's ways that we can measure that. We can count the number of beats over 15 or 30 or 60 seconds, and then you'll multiply it to work out how many beats per minute. Ultimately, we're looking for the quality and the quantity. We're looking for a regular beat. We're looking for regular rhythm. Anything that's anormal, so erratic, would be something that we may need to further investigate. Rhythm of the pulse should be regular and consistent. Anything that's deviating away from normal should be referred. And ultimately, it's important, especially when we're doing any sort of blood pressure screening or any sort of cardiovascular screening, we really do write down everything that we do. That way that we've got a nice record that if we do need to refer the patient, we can refer them on. Now, there are different types of issues with the pulse. We can have tachycardia or an increased pulse rate. Now, there could be very multitude of reasons as to why someone may have tachycardia. There's a few here. Stress, anxiety, fever. It could be down to shock, anemia. There could be some significant cardiovascular problems, so pulmonary embolism, infarction, endocrine issues, and the patient might have an increased pulse because of drugs. They may be on beta antagonists. They could be on high levels of caffeine, amphetamine. They might be on drugs. There's a variety of reasons why that may be the case. So if someone is suffering with tachycardia, it's worth asking them, are they on any medication? Is this something new? Is this something out of the ordinary? And then it's something that we may want to further investigate. So that's if the heart rate is high. We've also got brachycardia. Okay, that's where there is a lower heart rate than normal. And there can be some variety of reasons to why someone may have a brachycardia issue. It could be an autonomic issue. They could be on medication that could be suppressing their pulse. For example, beta blockers, calcium channel blockers, adenosine, ACE inhibitors, all can create a brachycardic effect. Hypothyroidism could cause it, where you have this reduction in the thyroid gland. Obstructive sleep apnea. These are all considerations. So if the patient's coming in and they have this underlying brachycardia where there's this reduction in pulse rate, again, it's something that we should be considering a referral. So as part of your general screening process for cardiovascular system, we'll do an observation of the patient first, which we've covered. Find the radial pulse and we'll just ascertain the quality and the quantity of the pulse. We're looking for rate, we're looking for rhythm, we're looking for an average beats per minute, which is around 60 to 100. We're going to note down if there's any brachycardia, so a reduction, or tachycardia, or an increase. Then we can start looking at our special tests. We can start looking at a radial delay or a radial femoral delay before we move on further.